Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on the physicians and practitioners who are redefining medicine through their integrative, functional, and holistic approach to health and well-being. We'd like to welcome Lori and Kelly, two fellows of the A4M, live here in Orlando at our A4M Spring Congress. Thank you for joining us.
Happy to be here, thank you.
Yeah, we're excited to be here as always.
So, Lori and Kelly, you're both nurse practitioners. Where are you based?
So I'm based in Mississippi, and Lori's based in Florida.
So you two are best friends for about 12 years. Tell me how your friendship started. It was here at the A4M, right?
It did. We're very grateful for A4M for bringing us together. So it was Lori's first A4M event that we met. And I had started the fellowship myself in 2009, and she joined in 2010. So, you want to tell?
Yeah, I do. I mean, it was cold inside. You know, when you come to a conference, it's cold. So
thanks
at lunchtime,
to Pam Smith.
Yes, thanks to Pam Smith. But yeah, so headed outside, and all the tables were full. Apparently, I wasn't the only one that was cold, and so I saw this one seat sitting at this table, and it's not my typical, but I was like, "Excuse me, can I please sit down?" My feet were tired. She's like, "Sure," and we just hit it off. I mean, she was just, you know, you start talking about, you know, what's going on around here and just the intrigue of just functional medicine. And I had so many questions at the time. I had already called A4M and I was interested in their modules, but I wasn't quite sure I wanted to do this and what it would look like. And so just took off from there. And in a matter of 2 months, actually less than that, I think it was 4 weeks, wasn't it? Mm-hmm. We were out in Vegas and we decided to room together in Vegas and go to our first module together. So that was an experience in and of itself as well. But yeah, so that's where it all started, and then we continued throughout the program, did the modules pretty much together simultaneously, did the program at University of South Florida as well, the master's degree.
Right.
And graduated.
Both graduated, yeah. I think I was a little bit ahead of you maybe.
Yep.
In graduation from the master's program, but did most of it concurrently. So it was really, it made it fun to have someone else going through the same thing and learning and processing. And then, of course, when you're here on the exhibit floor, just trying to put the pieces together of how to incorporate this into clinical practice was really a challenge. My practice started out as a hormone practice, you know, and then once I got properly educated, you realize that the functional piece is so foundational to helping people not only get balanced, but stay balanced.
And my practice, unlike hers, being hormones, mine was metabolic. So I was doing the hypertension, high cholesterol. Mine started out truly as a weight loss clinic because my history, I was diagnosed with diabetes at 25. And I was doing internal medicine, and I knew that wasn't, I wanted to be able to help people learn what I learned, is that you could take a food-first approach to changing the outcome. So we came really from two different backgrounds.
And I remember Lori just not wanting to implement hormones at all. And I finally had to say to her, look at me in the eye, you're already doing it. You're already balancing hormones by getting rid of inflammation. That's half the battle. Yeah. And now we just incorporate what's missing, right? And then she saw a whole another layer of healing for our patients in incorporating the hormones. So we had very different approaches initially, but they blended well. It helped. We learned a lot from each other.
We did. And it's interesting that you say that because on the metabolic side and the weight loss side, I had been doing the food. I mean, my clinic was all about food to begin with. In fact, the first 3 years was all about weight loss. And it wasn't until I really understood and I started implementing what we do here is that I understood that there were metabolic disruptors of disease states that you have to break down in order to get a person to achieve their optimal overall body composition. So it's, you know, so it was that side. So she learned that part, and I was able to integrate hormones. And then, you know, our clinics have taken a little bit of a different turn recently with, you know, mold and biotoxin. But it's really cool to see that path together.
So Lori, can you enlighten us to what the food first approach is all about?
Yeah. So one of the things that I feel like people really don't understand is the criticality of the choices they make every single day with food. And so if a person comes to me seeking hormone therapy, the first thing I say to them is, I can't help you unless you're willing to foundationally change how you eat, you sleep, you think, and you breathe, basically, right? So the food first approach is creating a solid foundation of teaching them specifically what they need to eat, how they need to eat, You have to do some testing, right? Test instead of guess, and really dig deep to understand what a person specifically needs, but then coaching them on how to do it. Most people truly, they desire to be well, they just don't know how to do it. So it's the practical application.
And food's 80 to 90% of the battle. I mean, if you can get the food right, then everything else works better. And without that food first approach, I feel like it is an uphill battle. You know, I see patients coming into my practice who have already been started on hormones maybe without any nutritional counseling, and maybe they get better for 3 months, but then they cycle back through that whole inflammatory state, and you just can't really get them well until they start changing some foundational things with nutrition. So totally nutrition first at my practice as well at this point.
And I think that's the difference between feeling better and being better. Because people can feel better for a temporary period of time when you change 1 or 2 things. But are you really going to be better long term, and are you resilient so that when things come your way that you can overcome them? So.
And Kelly, when you started the fellowship, what began to change as a result in your treatment of patients?
My first 8 years of conventional practice was in a women's health clinic. So I was very comfortable with the hormone side of things, so I thought, right? We all have an entry level, right? And then I came to the fellowship and I was like, I've got to relearn everything, right? But it was great because I really had, I had the passion for helping women reach optimal hormone balance, and just having a better understanding through the education of A4M just help that process. As Lori mentioned, the testing is so important. And back in the day in conventional wisdom, we did all serum testing for everyone, if we tested at all, right? And we miss some nuances in being able to keep people balanced and get people balanced by only using serum testing. So being able to test appropriately depending on what we're trying to see, whether it's salivary, urinary, or blood, and maybe even all of that over a period of time, definitely changed my perspective on what to do for these patients.
Do you have a preference in terms of testing?
I use them all. So it depends on what I'm trying to see and what I'm trying to accomplish. So it's very patient specific. It's individualized medicine based on what that patient needs at that time. Yeah.
And also, I think what varies too is the method in which you're treating them. Is it pellet therapy? Is it creams? Is it troches? What is it? Because it's really that is very important in your decision-making process as well. So it's so intricate, and I think that's been the walk is really figuring that out along the way, because oftentimes what you see clinically isn't exactly what you're taught, right? So you've got to be able to see those nuances. And having someone that has a clinic, and you both have similar clinics, even though we are, Mississippi and Florida, but having that person you can pick up the phone and say, listen, what do you think about this?
Right. This is what I'm seeing. How would you see this? You know, it really helps. And coming here to A4M helps your confidence too, because you get to network with so many people, vendors, as well as the faculty, helping just navigate your process. Yeah.
So your nervousness a bit into moving into hormones, how did you overcome that? Obviously the education was paramount. Did you slowly integrate to certain patient cohorts? Did you just say, closing the door on the past and start it over?
I think what I realized most is when I first came to A4M, it was all about hormones. And I think there's been a shift even for A4M's teachings too. And so I think that's what the pushback was, is because I knew that if I just focused on hormones, I wasn't going to get the outcomes. I knew that. And I think that's where I was bucking the system. It wasn't because I didn't believe in hormone therapy. I just knew it was a piece of an equation. And I just didn't, I'm a strategist. My personality testing is I'm all about strategy. And so when I figured out that basically there's these pillars to health, I kind of like to, equate it to a chair that you're sitting in, and there's ways in which you have to do it, building the foundation. So nutrition, detoxification, exercise, getting them moving, and hormone balance, and seeing that as a full, you got to look at the whole picture. I gained confidence in that way because it became part of what I was doing, and not I wasn't a hormone clinic, right? I wasn't a hormone clinic. I was a clinic that was helping you take a different approach to your overall health. And so now I feel extremely confident in it. I feel confident in having that conversation I started out with and saying, listen, if you're coming to me just for hormones, this is how it has to be. So if you want to work with me, I'm not one that you're just going to come in and get pellets or get a cream. We're going to take this path and you're going to learn specifically how to eat better, how to clean up your body better, how to move your body better, and how to integrate these hormones safely. Because you put hormones into a body that's not deloading very well, not detoxing, you can actually create more harm than good.
Yeah, and that's why I love the urinary test, because you can actually see that. How are they metabolizing their hormones, and help them with nutrition or maybe supplementation and lifestyle movement, those kind of things.
Yeah.
You touched on detoxification, which I think has a lot of big words, methylation, chelation. How do you drill that down in your patients? Because they might hear detoxification and say, okay, I'll do a cleanse for a week.
So what do we mean? So what we say is our bodies are detoxifying every single day, I mean, every single second of every day. And so we're just supporting the body's ability to offload, right? By particularly minimizing what they're getting in. So clean water, clean air, clean food first, and then upregulating maybe some of the nutrients that help offload, right? So supporting specific genes, an epigenetic effect based on lifestyle management. So it's pretty cool. Detoxification can be a scary word because they think about things they're seeing on the internet. Maybe it's a colon cleanse or a liver flush or something.
And that's where I start. Yeah, that's where I start. I'm like, it's not a colon cleanse. Right? It's not a colon cleanse. And sometimes you have to start that with people. You have to tell them what it's not before you tell them what it is. Yeah. And then by defining it, as you said, it's basically reducing the incoming burden while you work really, really hard on upregulating your own body's potential to get rid of stuff. See, and you have to do both at the same time.
Absolutely. Yeah.
Yeah.
Make it sound so simple.
But that's how we have to, we're dealing every day. We were just talking to a few of our vendors that way. We're in it. Like, we're on the front lines, and we're hearing, and we get that deer in the headlights look sometimes when a person doesn't understand it. And I found that there are certain terms through practice and totally messing up. I mean, you have to be willing to mess up to get beyond. But just in learning that language of how to make it more simple for them and break it down into bite-sized pieces so it's not overwhelming. Because when you're sick, you don't have a whole lot of energy for change, and you have to budget that energy, right? And we have to respect that as providers too, is where are they coming in at, and how can we break it down in a way that they understand? I call it fun medicine. It's fun.
Well, I say we put the fun in functional medicine.
Oh, hey, that's good. Yeah.
That is perfect.
I love it.
Yeah.
How about the patients that you're seeing currently? What are some success stories you've had? Do you have any segments of your patients that still are a bit of a conundrum to you? What are you seeing on a day-to-day basis that's really in the front of your minds?
I love this success story you shared with me this morning. So you have to tell that
one. So I don't see a whole lot of children. I only will see a child if I'm seeing their parents, because unless the family's on board, it's very difficult to implement a lifestyle medicine program for a child, right? But I had this child that came to me, age 15. He was being homeschooled because he couldn't perform at school. His dad was really putting pressure on him, thinking he was just not performing, right? He was overweight. Had major autoimmune conditions, 3 already diagnosed at age 15. And so he comes into me with all of this litany of symptoms, multi-symptoms, and we finally figured out that he had chronic inflammatory response syndrome from a mold exposure. And it had been a previous home. However, they had transferred some of that toxicity to their current home. And through cleaning up the process, he's lost like 35 pounds, grew 6 inches since December. Just looks amazing. I've got the pictures on my phone.
Since December.
Since December. And he's so proud of himself. Like, he is like a different child, performing now in school well. And so just being able to see something like that in a 15-year-old, right? Following a protocol that's very challenging for even adults. To see that is just amazing. That's what we get to be a part of every day.
That's inspiring.
Yeah.
And it's really cool because, you typically don't treat that subset of population, where for me, I do. I do treat a lot of younger kids with diabetes, metabolic disorders and such. And so I had been working, I have several teenagers in my practice with very similar, not the chronic inflammatory response syndrome, but very similar outcomes, just really engaging their families. So it is rewarding. I have a lady who I've recently, she's amazing as well. She had approximately like 45 to 50 gut surgeries and literally had paralysis of her GI tract and came to me in just utter frustration, couldn't eat out, couldn't eat home, just really frustrated with how she was feeling. And through a process of diagnosing and doing some testing, we were able to completely change her food. She's been with me approximately a year and a half, and she now eats the way she wants to, drinks the way she wants to, meaning non-alcoholic beverages, but she's functional. She is able to, you unleash creativity.
Oh, absolutely. Yeah.
In all of our clients that they had to, again, they were budgeting energy. So she is now a photographer. She has always loved and dreamed to do it, but hasn't had the energy to do it. And now I've recently moved into a new practice, and she loves beach pictures, and my facility is more of the beachy theme. So she went out and took some really cool pictures and had them framed for my office. And
That's
so
awesome.
I have memories of her throughout the practice.
Oh,
Yeah,
sweet.
Yeah. So it's that.
Gratitude.
Yes, absolutely.
It
Yes.
is. Yeah.
So the logo for my practice is the ripple effect. It's a pebble in the water that spreads, because I feel like when we help one person in the family, we're helping the whole family. And that's really what we're encouraging, is not just an individual change, but a family change and a community change. And it's really great to be a part of that process.
And hence the reason, we developed a company together, Synergee, because there's such synergy in relationships, and being able to pull all of that in and be able to, that ripple effect doesn't just stay in your locality. We wanted that ripple effect to transform the lives of other people outside of our hometowns. And so Synergee will allow us to reach more people beyond our own hometown. Because, I live in a very, it's the mecca of retirement, right? So they're there, and it's young retirement. So it might be 6 months here, but then it's 6 months, back home, if you will. And they have family that now see their change. I mean, their kids are seeing how they're thriving now, not just surviving. And I want a piece of what you're doing. What is that?
Right.
So how do you
having
reach
a platform to be able to reach.
So is Synergee a business that's an online platform or a connection tool?
We're in the foundational stages of it, but at the present time, we're really working on writing a book. And then it will become a platform, absolutely, through coaching, not only of individuals who are seeking better health, but also we're hoping to be able to help other practitioners who are in the newer stages, who really, really want to convert their practices to more functional medicine, but they just don't know how. Kelly's practice came from an all insurance-based side, and she's converted her practice into cash. I came from day one, and I was the one that was broke for a long time and started from nothing. It took a long time, but there's beauty in all of that, because, we have those different backgrounds that we can help other providers feel more confident in whatever transitions they have to make to do what they love to do.
And that's a great point to sort of sum it up, Kelly and Lori. You've done a lot in the last decade or so in this field, in this industry, and there's still more to be done, right? And in particular, that point of converting your practice over. Do you have any advice? How did you do it? Did you talk to your traditional colleagues and say, hey, this is what I'm doing, come with me?
I did. Let's take a
Did
deep
you
breath.
did you kind of have to close the lights on one to move to the next?
So for me, I took a dive, and I just said, listen, I was still working primary care with another physician when I originally started my clinic. So I started my clinic working part-time, total nutrition and therapeutics, while I was working in family practice. And I did share it with my colleagues. Unfortunately, my colleagues weren't that supportive. It's good luck with that, because if you're not offering a pill for weight loss, and if you're not offering, you know, something like HCG, which I didn't, I was taking a completely food-first approach, and that was, I was steady on that. I wasn't going to compromise that. And they told me I was crazy, that I wasn't going to make it. And that was okay, because I'm pretty tough, and I've been through a lot of things where people told me no, and I think that kind of motivated me more. So, you know, so I just went forward, and it was a couple of years. It took me a long, long time, but it was all worthwhile. Your story is very different.
Yeah,
than
my
mine.
story was very different. I was insurance-based, and insurance took a dive as far as what they were allowing for functional medicine testing. And so I had to make a really difficult decision, because I had a great, thriving practice. And so I gradually transitioned my practice over, like one day at a time. So I went 4 days conventional, 1 day functional and cash-based, and just over the course of probably 8 months. It was very challenging having the conversation with patients to have them understand that that was a very difficult decision. It wasn't something that I really felt like I wanted to do, because I feel like they're sick and insurance should be covering some of this. However, it wasn't practical, and it wasn't allowing me to tell them what they needed to hear and educate them the way they needed to be educated. Basically, insurance told me 7 to 15 minutes per visit, and there's no way I can scratch the surface in 7 to 15 minutes. And so in 2014 is when I took the leap and transitioned over. And I'm so happy that I did it, but it was very, very difficult. So I think my advice would be, if you have the opportunity to start cash, start that way from the very beginning, so that there's no miscommunication with your patients as to your intent of making that decision.
Yeah. And for me, it's the same thing. Even though it was really, really tough, when I was still working in primary care part-time, I felt like I was talking out of two sides of my mouth. Honestly, I felt like I was in this conundrum all the time. You know, here is your diagnosis. Well, what can I do about it? And I had 8 to 12 minutes to basically tell them what to do. But I knew how to change it. And so I would have to tell them, you have to come see me at my other clinic for that. And that's just a very uncomfortable dilemma to be placed in. Yeah.
Not being true to yourself.
Yes.
That's not what it's about.
Right.
Right.
Yep. So I agree, you know, if they can start out that way and put some money aside to do it, and then when they're in, go in. And I remember the hesitation in 2014. I'm like, you just have to do it. And she's like, oh, but like, you just have to do it. Let's do this. You know, you can do this. I'm doing it. You can do it too. So
Completely took the dive.
Yes.
I commend both of you. Really, it's brave, it's important, and I'm sure your patients are eternally happy to have you.
Yes.
So we look forward to seeing you again here at the A4M, and stay talking with us, staying connected. It's been a pleasure. Thank you.
Thank you.
Thank you for having us.